Hi everyone, welcome back. This is part 3 of the gluteal injuries series, and in this video we're talking about this lovely muscle here, the gluteus minimus, which is a fairly sort of broad flat muscle which together with the gluteus medius forms a good part of the hip. And of course the gluteus medius, gluteus minimus lies deep to the gluteus medius and the gluteus maximus. So the gluteus minimus attaches at the ilium of the pelvis and the greater trochanter of the thigh bone, and is separated from the gluteus medius by nerves and blood vessels. And the functions of the gluteus minimus, basically it will enable hip extension, hip abduction and rotation of the thigh. It acts as a hip rotator along with the gluteus medius and the tensor fasciae lata. It also will help to stabilise the pelvis when the opposite leg is raised above the ground. So it may be a small muscle, but it's quite important. And certain medical conditions may contribute to gluteus minimus strain. So similar to with the gluteus medius, which was in part 2, this will include things like trochanteric bursitis, sciatica, intervertebral stenosis, hip dislocations, piriformis syndrome, sacroiliac joint dysfunction, ankylosing spondylitis, and Cauda-Equina syndrome. So it's important, obviously, to if you have any of those conditions, to just be aware that sort of any additional pain, potentially it could be that you've strained one of your glutes. In terms of causes of gluteus minimus strain, so again, you're looking at any occupation which requires a lot of standing, particularly if you're someone whose standing posture is quite poor. Which then will increase pressure on the hips, particularly when the weight of the body is not equally distributed in between the legs. So if you're someone who has a lateral pelvic tilt, for example, quite often mums, carrying a child on one hip, this will be the case, and do look at my video on pelvic tilt to get more information about that. Also, if you're someone who sits with crossed legs for a long period of time, or maybe through work you're lifting and carrying heavy items quite a lot of the time, or if there's repeated jumping, so in athletes such as long jumpers, high jumpers, there's going to be obviously those repetitive movements, but also a high impact on landing. And also another common one, surprisingly, is this is going to be particularly men, people who keep wallets in their back pocket and then sit for long periods of time. This can cause a muscle strain, so don't do it. Symptoms of gluteus minimus strain, again, like a lot of these gluteal injuries, you're going to have severe pain in the buttocks, you're going to have pain in the outer hip, on the outer thigh, sometimes pain behind the calf, which will radiate down to the ankle, numbness in the buttocks, sometimes also the hip and thigh down to the ankle, difficulty in walking normally. You may sort of develop some compensatory patterns, pain when lying on the side, which obviously the injured side, and also difficulty in getting up from a seated position. So again, quite similar symptoms to a gluteus medius injury. Treatment, again, these standard treatments, anti-inflammatories, pain relief gels, cooling gels, or cold packs, usually for about 15 to 20 minutes, 2 or 3 times a day, just to reduce any inflammation. Warm compresses, 15 to 20 minutes for pain relief. However, with a lot of sports injuries, it's advised to actually alternate like cold and warm packs to work simultaneously on inflammation and pain. With a gluteus minimus strain, the advice is actually do not do these simultaneously, as it can affect the resolution of the symptoms. So you're better off just using cold packs initially for any inflammation. Then once you've stopped those, once the inflammation has subsided, you can then go on to use the heat packs, to help with pain. Other things you can do are get hip supports to help control any inflammation and swelling. And of course, once the pain and inflammation have subsided, then massage just to help with circulation and help, with any just sort of lingering minimal pain, and strengthening the surrounding musculature will really help. And there may also be sort of some exercises you can do, again, once pain and inflammation have subsided, just again to sort of strengthen that area, and sort of maintain some flexibility, etc. So in terms of exercises for the gluteus minimus, so the first exercise you can do to help with your gluteus minimus is an outer hip stretch. So you simply lie on your back with one leg straight and the other leg bent at the knee, trying to touch the inside part of the knee on the straight leg with the foot which is bent. And then you're going to try to twist the hips at the same time, keeping the other leg straight. You're going to try not to move the upper body, try not to twist the upper body. And you're going to pull that knee across and maintain that stretch for about 30 seconds. And then obviously you can, if it's preventive that you're doing this, you can repeat it on the other side. And that will give a stretch on that gluteus minimus. Then this glute stretch is actually, it's a really good all-rounder stretch on the glutes, but it is specifically targeted for the gluteus minimus. And you simply lay on your front with one leg bent. Obviously, if you're working one side, it's the injured side, you want to get bent below your abdomen in the front, and the other leg will be sort of stretched out behind you. And what you're going to do is you're then going to lean forward over the bent leg, and you're going to maintain that position for about 30 seconds. And then, of course, if it's preventive, you're going to do the other side. Now, with this stretch, if you're just starting out, you may not be able to get that front leg right up under your abdomen. Obviously, so just sort of as far towards your abdomen as you can do. The closer that leg is pulled in towards your abdomen and your groin, the more effective the stretch will be. But do go at your own pace and sort of build it up gradually. And then finally, another one that is specifically targeted towards the gluteus minimus is this sitting gluteus minimus stretch. So you're going to sit with one leg straight and the other leg with the foot against the inner thigh of the straight leg. And again, the closer you can get that foot in towards the groin, the more effective the stretch will be. And then keeping your spine as straight as possible, you're going to lean forward to try and touch the toes. This will also stretch the hamstring a little bit. And you're going to hold it for about 30 seconds and then repeat on the other side. So when you've had a gluteus minimus strain, how long should the recovery process take? You know, how do you know when to maybe return to sports? So generally, obviously everyone's different, but generally we'd say 3 to 4 weeks for the symptoms to resolve. If you're using sort of heat and cold packs alongside anti-inflammatories, this could continue for 2 to 3 weeks, and in that time you should really be placing no stress on the hip or pelvic region. So this means no standing for too long, no walking long distances. You know, the more you rest, the faster your recovery will be. Once the symptoms are resolved, a gradual return to normal activities over the course of 7 to 10 days is recommended. So, as with most sports injuries, you know, don't be in too much of a hurry to, you know, just suddenly get back to normal, because the likelihood is that you'll end up doing yourself a worse injury. So, yeah, take your time and do ensure that you are fully recovered. So that's gluteus minimus injury. The next part 4 video is going to be on gluteal tendinopathy. So subscribe to my channel if you want to be notified when that comes out. And of course, if you haven't already, you can take a look at parts 1 and 2 of this gluteal injury series. And there are other videos already up on things like sciatica and IT band syndrome, which may also be of interest. You can comment down below, you can contact me through my Facebook or Instagram. I'm on there as the medical massage lady, and yeah, I will come back to you, you know, if you ask me any questions. I will come back. As I say, do feel free to subscribe to my channel and you'll be notified when other videos come out. But for now, that is all from me. So I will see you in part 4. Take care. Bye.